Just as an introduction, the first part we're going to talk about is the pathology and epidemiology of equine pregnancy loss, just for the first half of this, and then it's all over to Joan for the second part on EAFL. So this part is quite a large team of us that I'll just introduce because it is a particularly stellar team. We have Joan, our specialist in equine medicine based in Scone. We have 3 specialist veterinary pathologists. Angela Begg, who many of you will know, has been an equine pathologist based in Scone and then in Newcastle for many years, very, very experienced. As Joan will explain, part of this project is really downloading her brain so that other people can use the knowledge that she's amassed over the years as well, along with Joan's. Also Melinda Stewart, who used to work for EMAI, head up EMAI, and Pat Shearer, who is with IDEX in Melbourne, and then Jane Heller and myself, who are both epidemiologists. So COVID didn't set us back, luckily. We are based over the southeast area of Australia, so we were working on Zoom right from the start, and we generally work well. We work very well by Zoom, and we meet every week, and that's our team, one of our first team shots there. So what's this project all about? The objectives really are that we want more of this, happy, healthy foals, and less of that. And so the objectives are split into preventing pregnancy loss on farm in individual mares. So this is trying to improve our understanding of the risk factors for the loss. And then also detecting and responding to outbreaks quicker to prevent further losses. So improved reporting and diagnosis and surveillance of pregnancy loss. As I'm sure you're all aware, this particular audience, there's a chain of events involved in pregnancy loss with diagnosis and reporting, starting obviously on the farm with a phone call, and then the post-mortem stage, followed by the laboratory testing stage, both of which generate reports, which we're using in this project. And then sometimes, or not, the data analysis stage. So that's what the epidemiology side is adding to this project. And all of those generate reports that feed back to the farms and industry. We're looking at basically improving that process overall, and developing a surveillance system for the industry as a whole. So I'll pass to Joan now, who's going to talk a little bit more about what the pathologists are doing.
Thank you, Viki, and I'll start sharing my screen and get the talk going. So yeah, lovely to get to explain what's going on and what we are doing as the pathology group. There are 4 of us, as Viki has explained. Pat, Mel, and Angela are the specialist pathologists, and my role really is as the field vet, who's actually done heaps and heaps of fetal postmortems just out in the field, and have talked to lots and lots of breeders over the years trying to figure out why their mares might have lost their pregnancies. There's very few vets in the world who are like me, that have got to do lots of fetal postmortems, and there's also very few specialist pathologists like Angela who've seen a lot of fetal histopathology and fetal pathology. Unfortunately, also there's very few little reference materials, so there's no real textbooks and nowhere for people to go to get the information they need to diagnose causes of pregnancy loss. And so our plan is to fill those gaps. Basically, we need to produce the manuals for the vets to both learn to do the pathology, learn to do the postmortems, and to have resources to know what they're looking at, and for the specialist pathologists. So we're basically going to be working on 2 areas. One is the postmortems, and the other one is the laboratory. And we're trying to get improved quality of postmortems and improved interpretations of the histopathology so that we can get a better, more accurate diagnosis for you as the breeders. So the first part is we'll look at the postmortem examination. So what we want to do is outline a systemic a systematic protocol for doing fetal postmortems. And once we've outlined this, now that we've outlined it, we're developing a manual for the vets to have so that they've got something to take into the field with them to help them go through the steps of doing the postmortem so they don't leave things out or get confused as they're doing it. Because if we don't do a lot of them, it's quite a difficult and complicated procedure, and you can get a bit lost and forget to collect things. And the other part is that we'll also then train vets in how to do the postmortems and how to collect the samples optimally so that we can get the best results possible. Also, we are going to develop the reference manual that doesn't exist at the moment. We're going to describe in detail all the gross pathologies of the different causes of pregnancy loss, as well as put in lots and lots of images so that the vets can go to this resource, and if they've just done a postmortem and they've characterised what they've got and they've seen things, they can then refer to this manual and get an idea of what they're looking at. We'll also be training the vets to recognise what are the important characteristics of each of the different causes. And so that's what we're doing quite hard at the moment, is trying to define clearly how to differentiate the different causes and what it is that Angela and I do and think about and think is important in recognising each of the different causes of abortion. Then the other part of it is to help the specialist pathologists, because this is another group of veterinarians who just don't have the experience and don't get a lot of training, and also don't have anywhere to refer to get information. So we're creating a visual atlas for them, another manual. We will be describing the histopathology very, very in detail in the language that specialist pathologists understand. And we'll also, Angela, Mel and Pat will be available to provide some advice to the pathologists so that they understand it and understand the reading of the slides, and they can make better sense of the information that's on the slides to advise the veterinarians so that they can then give you better advice about what's caused the pregnancy loss and how to prevent it in the future. So I'll hand over to Viki now, who's going to tell you about what the epidemiologists are doing.
Rightio, here we go. So we're involved in the data analysis stage, of course. So we're using a lot of the information that Joan and Angela have generated from the submissions over the last 5 years or so, especially in the Hunter Valley, in this data analysis stage here. So the first part of it is identifying risk factors. Some are already known, but there's a lot more detail that we can go into, and we're hoping to find some risk factors for some of the less described syndromes as well. So basically we'll be comparing mares with and without abortion, so cases and non-cases, and we'll be contacting farms over the next 6 months to collect information about the non-cases. The cases is made from the case series of the submissions over the last few years, and then we'll be looking at differences in mare factors, environmental factors, and particular diagnoses that are made around those cases to see what we can identify there. The other part of what we're doing, which is really much bigger and will be developed much more over the next few years, is developing the basis of a surveillance system. Currently, there isn't a combined surveillance system for the thoroughbred horses in Australia for abortion, and so we can use the case data that we've already got, and so the retrospective data, and we're also looking to get prospective data as well from farms, particularly in the Hunter Valley area and Newcastle area to start with, but hoping to extend into Victoria and in Queensland as well. Looking at the normal, there is a baseline amount of abortion, the areas it occurs in, and the times of years it occurs. You can already see some output here. We can see that 2016, for example, the peak was a little bit higher. We're all used to looking at curves these days, than 2015. And we can put that sort of data, these are clusters around the Scone area where you'd expect, that's where the horses are. But some years you might see some clusters more intense than others. Put that into a surveillance system that then comes up with the expected amount per year on average over time and the expected places. And then if something unusual happens, like we get more cases of a particular type in an area or in a particular time of year, then that surveillance system can be automated to ring a virtual alarm bell that then generates information to go, okay, there's something strange happening in this particular area that we don't normally see, go and investigate it. And it may be that we can pick up abortion outbreaks more quickly than we have done in the past. So we're going to be requiring a lot more data to go into that system. This sort of system becomes more accurate the more information that you that gets put into it, and the longer it runs for as well. So that brings me to the phase 2 of the project, which is how farms can help. So I'll switch back to Joan, who'll tell you a bit more about that.
I'll stop sharing my screen. Sorry, I'll just, there we go. So what are the next steps? Initially, what we'll need is, what we'd really like is to see lots of support from the industry for this first phase that we're currently embarking on, and particularly from the industry is to help the epidemiologists collect and collate their data. The epidemiology team will be contacting farms and asking for permission to retrieve their data and store their data. Now, this will be done anonymously, so they'll be de-identified using systems usually for the mares and for the farms. So nobody will know what mares and what farms are involved in this project at all, and so you do retain the confidentiality for your mares and farm. The other part that's very exciting is that we're going to be embarking on phase 2. Now, we originally planned to do phase 2 when we'd completed phase 1, but we've been really lucky in that some extra funding has become available, which will be able to support the investigation of abortions. And so we're going to be able to move ahead with this phase of the project a little earlier. And the primary aim of this is to test out the system, because the long-term plan for this project is to develop a surveillance system, as Viki said, where the postmortems, the fetal postmortems are done consistently by experienced and well-trained veterinarians. The laboratory work is done by pathologists who really understand equine fetal pregnancy loss, and that information is then stored in a surveillance system is available so that we can get ahead of any outbreaks and we can reduce to a minimum the pregnancy losses, the abortions that we see. So initially, we don't want to run this system straight out across the country. We need to test it out, and this is what phase 2 will do. So what we'll be doing is we'll be expanding the training of the vets into an area for some vets in southeast Queensland and some vets in northern Victoria. And you'll have an opportunity then to provide these vets with fetal postmortems, and the investigation of that will be supported by the research. Unfortunately, in order to keep it under control and to test the system and make sure we don't have any problems, major problems, we're going to need to limit it to probably 1 to 2 vets in southeast Queensland and 1 to 2 vets in Victoria, so that we, and that will be for, we're hoping that this will roll out for next year. And once that system is up and running and the 2 phases of the project are completed, we will be able to present to you as the industry a way to investigate postmortems across the entire country and give you the opportunities to see what you can do with that. So that's at this point we're finished with this part of the talk. Do you want to, Charmaine, do you want to talk about, do you want to ask questions now? Or would you like me to move on to my next presentation?
Completely up to you, Joan. I haven't got any questions through at the minute. So if someone does have a question, maybe we can get to it after your next presentation.
Okay, cool. So the next presentation is, I was asked to talk a little bit about EAFL, or caterpillar placentitis, and this will be primarily about EAFL, which has been investigated. We first showed its little head in about 2004, and the description of the disease and the way the disease was defined was work done in 2005, 6 and 7, which was funded by the AgriFuture's predecessor, Riddick. And then again, further research was done in 2013 to figure out how best to control the disease, and that we did this by looking into the caterpillar life cycle. So I think the first thing we need to define or determine is what exactly is EAFL. Well, the simple answer is EAFL is a form of placentitis. So it's one of the different types of placentitis. As you can see over on the right, these are all different forms of placentitis. And for us in the Hunter Valley, it's the most common form of placentitis. And what we do know is that if you control the caterpillars, you can reduce one of these major causes of pregnancy loss. You can really reduce the EAFL. So that early research in 2004, 5, 6 was conducted at the University of Queensland. Angela Begg was the pathologist that guided a lot of the training of both Kristen and Judy. Kristen and Judy did their PhDs, and Judy characterised the gross pathology and the pathophysiology of the disease, and showed that you could induce the disease with giving the exoskeleton of the processionary caterpillar. And then Kristen's work was to look at the pathology, the histopathology, and detail how exactly those hairs, how exactly these caterpillars are causing the disease. And they found out that it's primarily from the nest material of these caterpillars that contain large amounts of hair. And Judy's work characterised that a very small amount, like enough that'll fit basically into the palm of my hand, is enough to cause eating of this, and there's several palms of my hands in here, is enough to cause mare to abort. And then Kristen's work was to look much more closely at the caterpillars, at the caterpillar hairs. And we see that these caterpillar hairs are actually like javelins, they're spears. They're very, very sharp. They have these sharp points, and then they have these other like fish hooks, so that they basically go in one direction and they keep going. They can't sort of come back. When the horse eats them, it eats the caterpillar nest. These spikes penetrate the intestinal tract and can go right throughout the horse's body. But importantly, in the pregnant mare, they go through into the pregnant uterus, and they take bacteria with them. And that's what causes the placentitis. That's the way the bacteria get into the pregnancy. And once they're inside there, the immune system is not terribly good at actually getting rid of infections within the placenta in the pregnant uterus. And so they sort of take up residence and start causing lots of inflammation. So what are you going to see if you're seeing a caterpillar-induced abortion? We see it from sort of mid-pregnancy right through till full term. Now, the mid-pregnancy, the earlier ones, tend to occur quicker. So there's less time between the exposure to the caterpillars and when the abortion occurs. So they're often hairy little caterpillar, hairless little fetuses and quite autolyzed, because at this stage they don't tend to induce parturition very well. And then we progress through to partially haired, and then right to full term, you can have these thin, often meconium stained fetuses or foals delivered with very chronic changes. So there's been more time for the pathology to develop. What you'll look like if you look at the membranes is the characteristic thing is to look at the umbilical cord, look at the amnion, which is that sac around the folds, and look at the allantoic surface, the smooth side of the placenta. Is this where most of the changes occur? And in the early cases, the changes can look fairly mild, but just a little bit of reddening, a little bit of hemorrhage, and they don't look all that dramatic. As we get further along, as the disease progresses, we get it gets more chronic, and we start to see these thickening of the amnion. There's this ugly sort of almost granulation tissue type changes of both the amnion, that sac around the fold, and the umbilical cord, and you get this leather-like sort of thing, fibrin encasing the cord, and the allantoic surface gets quite badly thickened. But the furry side, the side that's up against the mare, doesn't tend to be as badly affected. In fact, quite often, on gross pathology, it looks normal. So the second part of the research that we did, that was done, was led by Professor Myron Zalewski and Nigel Persons, both from the University of Queensland, who led a team that looked primarily into understanding the life cycle of the processionary caterpillar that's been shown to cause the disease. And what we know is that in the wintertime, we have the pupae are sitting underground. So, you know, June, July, August, about now, they're all underground, no problems. In the spring, October, November sometime, they hatch and become moths. They mate, and then the female moths lay their eggs. So you'll get these, lay their egg masses, which are right here. And they are a golden yellow colour, which can be at the base of the tree, or they can be up in the tree, up along the trunks of the trees. So these are actually probably the easiest stage to pick. And then once you get into summer, the caterpillars have hatch and develop, and the next nests get bigger and bigger and bigger, and they tend to locate to one tree. And then once they've located to that one tree, they stay there unless they run out of food. But these nests get bigger and bigger, and it's and then later, as we get into autumn, the caterpillars then decide they're going to pupate. And when they pupate, they come down out of the tree, and they then march across your paddocks. So all across your mare paddocks, you've got these hairy caterpillars marching along in processions, leaving lots and lots of hair on the pasture for your horses to ingest. But they also, the other problem we've got is that once they have distributed themselves across the paddock and pupated underground, then these nests that we've got down here start to deteriorate because they're not being looked after anymore by the caterpillars. And they deteriorate, and that nest material spreads out across the paddocks and is available for your mares to eat. And that is the last thing you want. So I've just got a bit there. We do know that as part of this research in 2011 and 2012, we were working with about 7 farms, large farms in the Hunter Valley, some of which had a fairly high incidence of EAFL. The grey bars represent the incidence of the 2 different groups of farms from 2011 and 2012. And the group that had a very high incidence were very concerned about what they were seeing. And so they became quite passionate in getting rid of all the caterpillars and their nests. And as you can see, in 2012, they had a massive drop in their EAFL cases. Whereas the farms that didn't get quite as many in 2011 weren't so worried, and they got just as many cases again in 2012. And what I do know is that if you reduce the number of caterpillars that your mares are exposed to, they certainly will, it will definitely reduce the amount of EAFL cases that you see. So I think I'm done now, and my computer is not behaving very well. So struggling with my thing. So I will try and stop sharing in a second.
That's okay, Joan. While you're figuring that out, we do have a question here saying, how does EAFL here differ from cases and outbreaks in the USA? Different caterpillar species? Question mark.
It's a great question. The USA have a few years, beginning of 2000s, they had something called MRLS, and mare reproductive loss syndrome, and that was the result of exposure to the eastern tent caterpillar that lives in cherry trees. Those caterpillars have those spines, but they don't have quite as many of those spines. The pathology of the disease is similar. The timing of it is a bit different, because the eastern tent caterpillar is in the environment, out in the environment, shedding their hairs at a different time in the breeding season. It was at the time when really late in gestation, and when they were trying to get the mares pregnant. So what they manifested primarily was a loss of early pregnancies, and then a lot of late-term pregnancy losses as well of the mares that hadn't quite, hadn't foaled yet. So it presents differently, and the timing of it, but it's caused the pathology itself, and the bacteria that we isolate from the horses, from the mares, is very similar. So we think they're much the same disease. It's just the eastern tent caterpillar is a little easier to control, but they really basically have just chopped down all the cherry trees, unfortunately. Whereas the processionary caterpillar here is a native, and it likes just about, and you can't go around chopping down every native tree that we have in Australia, because that wouldn't work terribly well. There are probably other caterpillars in Australia that are capable of doing this, causing this problem. There's there's several hundred caterpillar species that have the capacity to cause irritation, and that will have these spikes. Some of them, but just depends on exposure and numbers and what our mares get in contact with. So I think there's certainly concern about the grass anthered caterpillar. It does a little like what the eastern tent caterpillar does, and it carpets it carpets the pastures, and it's not as irritating as the processionary caterpillar. So caterpillar to caterpillar, it's not as dangerous. It's just that when it comes out and it just covers your paddocks, it's very dangerous. It seems to be able to cause abortions too.
Thank you, Joan. I think we've got everyone's questions now. I'm just having a look. Oh, we've got one more here. So Glenda, this is more a comment from Glenda. I had antlered caterpillars in Yay. They were invisible as they hatched from underground. The placentas were destroyed.
Yeah, that could be really difficult. I think we probably need to try and understand the grass anthered caterpillars better. We haven't done the same. There hasn't been the interest and the funding to find the right entomologist to get in and do that sort of research. So hopefully that someone will come on and do some investigations in Victoria. But that's where the fetal postmortem project should identify that you're seeing cases of EAFL in Victoria and where they are, and that will then allow us, on any farms that are seeing a large number of cases, we'll be able to then get the epidemiologist will identify the risk factors and be able to investigate what's going on.